Hello squeezers! Today we will present you the third and the fourth muscles of the rotator cuff family, Teres Minor and Subscapularis. The introduction for this video would be a little bit different since you already know what are they responsible for and what kind of malfunctions they can have. So I want to encourage you how to palpate this muscle. So you put your hand on your shoulder and go down with some pressure under infraspinatus. You will feel kind of warm, and do rotation. So you're supposed to feel Teres Minor muscle. Okay, then subscapularis. Raise your arm to say hello. Raise your thumb to say it's cool. Then go with your thumb under your armpit to your armpit and try to rotate this muscle. Okay, if there is any massage therapist around here, okay, try to rub with your thumb this nice area. Okay, this face saying it's not the nicest area to doing massage for both the therapist and for the guest. So note that you need to be really gentle as there is a lot of blood vessels, lymph nodes and nerves, and probably your guest will never use this magic sentence. Could you please press harder because it's quite sensitive area. Okay, let's go work. Teres Minor starts on the upper 2/3 of the lateral border of the scapula. The fibers end in a tendon attached to the greater tubercle of the humerus. Teres Minor laterally rotates the arm and stabilized humerus. The subscapularis muscle is a large triangle-shaped muscle that originates from the scapular fossa, the fibers from a tendon which inserts into the lesser tuberosity of the humerus and the front of the shoulder joint capsule. Subscapularis internally rotates and adducts humerus and stabilizes shoulder. Okay, as Teres Minor is a muscle lies under the infraspinatus, so I'll just show you one technique, and you can use all the techniques from infraspinatus to warm up your muscle. Okay, then you can ask your guest to rotate. You can show him what kind of movement to do. And is it the painful spot? Okay, so you can stop doing rotation and you can press. It's kind of trigger point therapy. Just press constantly and go to insertion. And if you will feel, or your guest will tell you, oh, this is the spot, you can wait a little bit. Is it the spot? Maybe here?
No.
Not here. There? Okay, so you can rub. Yes. Cooperate with your customer with his way of breathing. It's really important, especially in a trigger point. Okay, then release a little bit and he breathes out and go to insertion. Okay, and repeat it as many times as it's necessary. Then let's go to subscapularis. You go down under, and it's not that easy to get to this muscle. And try really gently go with your thumbs toward the scapula. Please remember that it's really, really gentle place. Is it okay for you?
That's this one.
Okay, and this is this one, cool. So do kind of friction up and down. Do you feel the numbness in your hand? Okay, you see, I don't use this much pressure and your customer can feel the effects. Okay, first make sure that your guest feel comfortable, that especially when it's a woman, that she is covered, that her ribcage is covered, and put the arm of your guest over there. Okay. If your guest is ticklish, pretend that you are ticklish, so you can adapt with this movement. You can do some friction firmly and really gently go and ask your guest if you feel if he feels the pressure. Okay. And go really slowly. Can you feel the reaction? Keep breathing. Isn't it too hard? Is it okay for you?
It's fine.
Okay. If you feel some weird structure, which is not a muscle, just release the pressure and try to go deeper. Okay. Okay. And finish as a reward for his pain. Oh my gosh. See? You need to remember to cut your nails. So I hope that you enjoyed the video and you've got the portion of knowledge. So, squeeze you guys.